In the late 1990s, thousands of Australian troops deployed to East Timor to keep the peace in the wake of a violence-racked vote for independence.
Viva Timor Leste!
Only a handful of Australian soldiers died serving in East Timor. Most of the casualties occurred long after the soldiers came home.
They feel disenfranchised and often are the victims of a great deal of stigma. And I think that situation needs to change with some urgency.
I was really saddened and kind of disgusted in the fact that so many of these soldiers were given these drugs, and I guess the way they were given these drugs as well, with little to no choice.
The drug was Lariam, also known by its generic name, MEF-TOX-VET. It's a controversial anti-malarial drug that was given to over 1,300 Australian soldiers in East Timor. The North Queensland city of Townsville is home to more than 20,000 soldiers and veterans. It's here that Lariam's effects are felt most keenly. 7:30 spoke to a group of affected soldiers and their families.
They have all the guys' names. They need to reach out to these guys and tell them what their symptoms are, just so then they can know. They know if what they're experiencing today could be as a result of the drugs.
Lavina Salter is all too familiar with Lariam.
My husband was in the army for almost 18 years. He served with the cavalry regiment, most of the time here in Townsville. He was deployed to Timor on 3 separate occasions and was medically discharged in 2008. This one was him in East Timor, yep. He was pretty happy that day.
Other days were harder.
He was exposed to quite a few traumas there in Timor on that trip. There was a water well there that unfortunately had a lot of chopped up body pieces in there. They were responsible for retrieving the body pieces and getting them organised, sent to where they had to go.
When Chris Salter returned to Australia, he was diagnosed with depression. A few months later, his unit returned to Timor and were trialled on Lariam. His depression should have prevented his involvement in the trial.
A lot of the guys that he was with pretty much said that they got sat down in a room and said, this is the drug trial, these are the side effects, and these are the side effects of Disprin. So the drug was likened to Disprin for them. At the time, they were told that there was a very slim chance that they would ever get any side effects from it.
Walter Davis served as a platoon sergeant during the East Timor mission and was responsible for making sure his soldiers took the drug.
Where there was no information at all provided when we were given the drugs, particularly myself, who was required to provide the drugs to the soldiers.
The information that I have seen suggests that they were not fully informed, and I think it would be really critical to follow that question through with an open and independent inquiry into how those trials were run.
Neuroscientist Jane Quinn has studied the effects of Lariam. Her interest is deeply personal. In 2001, her husband, a major in the British military, was prescribed Lariam while deployed to Kenya.
He had been given some information, but not very much, and said, well, everybody's taking it, so it should be fine.
Cameron Quinn wasn't fine. He experienced an immediate reaction to the drug.
He suffered quite a significant personality change, which culminated in his suicide in 2006.
We think that they have failed in their duty of care towards the troops, and to that extent, yes, it has been irresponsible.
Several weeks ago, a British parliamentary committee found their military had misused Lariam and recommended it be labelled a drug of last resort.
I think the current international situation should be indicating to the ADF that they also take the position that mefloquine or Lariam becomes their drug of absolute last resort, if at all.
The Australian Defence Force argues it's always been more conservative than the British.
Really what they've done is validated our very conservative approach to the use of mefloquine over the years. You know, we have never used mefloquine as a first-line medication. It's always been only kept in, only given to people if they can't tolerate our first-line medication.
Except in East Timor.
The issue there was our people deployed on doxycycline, our number one first-line drug. But in the first 5 months of that deployment, about 63 soldiers came down with malaria.
The ADF defends the decision to trial Lariam during its East Timor mission, including the use of a consent form which said psychiatric side effects were observed in less than 1% of subjects.
I wasn't there at the time of the decision making, but I think that was based on, looking at the broad scope of literature and what was known at that time.
The side effects of Lariam.
Jane Quinn disagrees.
The WHO and the manufacturer Roche had undertaken an detailed study in the late 1980s, early 1990s that had looked at risks and side effects and identified significant neuropsychiatric side effects in a proportion of people taking the drug. There'd already been a number of clinical case reports produced at that point in time. And it was present in the manufacturer's own public patient safety information.
Jane Quinn says soldiers like Chris Salter, with a history of depression, should never have been given Lariam.
I think it is alarming, and I think this is where the comparisons with the UK situation are quite apparent, that risk assessment process on an individual level, so an individual patient level essentially, was clearly not appropriately carried out.
Chris Salter was medically discharged by the Army in 2008 due to chronic mental illness, which he and his family believe may be linked to his Lariam use. Lavinia Salter and others want the government to reach out to everyone exposed to the drug during the East Timor trials and explain that Lariam may be the cause of or has exacerbated mental illness they may be suffering. Chris couldn't participate in this story because in early May he attempted suicide and is currently in a psychiatric facility. His condition, which involves hallucinations of East Timorese people telling him to kill himself, is so bad his medication has to be kept in a safe.
The last time he attempted suicide, I had to find a way to keep the drugs away from him. It's the third time this year.
That he's been hospitalised?
Yeah. It was the second suicide attempt this year.
Since you've known him, how many times has he attempted suicide?
I honestly couldn't count.
That many?
Yeah.
How do you live with that?
I have to do it for my kids. I'm a compassionate person, and if my kids weren't involved, I'd let him go because I know what kind of pain he's in, but I can't do that to my kids because they need their father.
Dylan Welch reporting. And if that story has raised concerns for you, remember help is available. You can call Lifeline on 131114 or Beyond Blue on 1300 22 4636.